Welcome to Have More Babies. Today we're diving into something that, well, probably sparks a bit of wonder, maybe even anxiety for new parents. Your newborn's head.
Absolutely. You look at this tiny person and every little detail seems magnified, doesn't it? Especially those first few days.
It really does. So you're wondering, is everything okay? Is that normal?
Exactly. And that's what we want to explore today, drawing on some great information from Omega Pediatrics about common newborn head characteristics and a few other related things too.
Yeah, we've looked at their insights, and the plan is to, walk through some of these common observations, hopefully easing some minds.
Sounds good. Where should we start? Maybe those soft spots.
Yes, the fontanelles. They can seem a bit delicate.
Right. There are these soft areas, usually one on top, one near the back. And people often feel nervous about touching them.
I get that. You feel like you have to be so careful.
You do need to be gentle, of course, but touching them lightly is perfectly fine. They're actually crucial. Think of them as like flexible joints in the skull.
Okay. So they're meant to be there, obviously.
Definitely. They allow the skull bones to shift a bit during birth, which helps. And critically, they give the brain room to grow incredibly fast after birth.
Okay. That makes sense. And sometimes you can actually see them pulsing.
Yes. That often surprises people, is just the baby's heartbeat you're seeing. Totally normal.
Okay, good to know.
And there's another reason they're important for doctors and nurses. They provide a sort of window.
A window. How so?
Well, by gently feeling the fontanelle, a clinician can get clues about the baby's hydration, or if there's increased pressure inside the head, helping spot potential issues early on.
That's fascinating.
Yeah.
So not just for growth, but diagnostic too.
Exactly. Now, another thing parents notice right away, especially after a vaginal birth, is the head shape. Sometimes it looks a bit cone-shaped.
Yes. Molding, right. I remember that. It could look a little alarming if you're not expecting it.
It can definitely look different, but molding is just that temporary reshaping of the head as it squeezes through the birth canal. It's actually a clever adaptation.
So it's the head being flexible for the journey out.
Precisely. And the really reassuring part is how quickly it usually resolves. We're talking typically within 24 to 36 hours.
Oh, that fast.
Often, yeah.
Huh.
By the time you're heading home from the hospital, you might barely even notice it anymore.
Okay, that's a big relief for many, I'm sure.
Oh, it is.
What about eyes? Newborn eyes seem to do their own thing sometimes.
Yes, they do. Vision is still developing after birth. So you might see what's called a disconjugate daze.
Meaning they don't always move together, like one might drift off.
Exactly that. A bit cross-eyed looking or wandering independently. It looks a bit odd, maybe, but it's usually normal for the first, say, 2 to 3 months as those eye muscles get stronger and learn to coordinate.
Okay, so another wait and see kind of thing.
Pretty much.
Yeah.
You might also see some redness in the white parts of the eyes.
Oh, yeah. What causes that?
Could be a couple things. Sometimes it's just tiny burst blood vessels from the pressure of delivery, like tiny bruises.
Right.
Or it could be a slight irritation from the antibiotic eye ointment they often give right after birth. You know, the erythromycin.
Okay. To prevent infection.
Yes. But either way, that redness typically clears up within the first week or two. Eyes usually look nice and clear fairly quickly.
And the pediatricians check the eyes thoroughly anyway, right?
Absolutely. They use an ophthalmoscope to look inside the eye, check reflexes, how the baby tracks light or faces. Serious issues are usually quite obvious to them early on.
Good. Okay, moving on slightly. What about ears?
Well, first off, hearing is screened in the hospital before discharge, which is really important.
Definitely. But what about appearance? Can they look a bit folded or uneven?
They can. Major developmental issues like a missing ear canal are usually picked up right at birth during the exam.
Okay, so the big stuff gets noticed.
Right. What the provider looks for is symmetry. Are they similar? The overall shape, the size, any little skin tags near the ear?
Skin tags, little extra bits of skin.
Yeah, sometimes babies have those. They also use an otoscope, that little light they look inside with, to make sure the canal is open and leads down to the eardrum.
Gotcha.
And newborn ears, especially the lobes, are super flexible, almost floppy sometimes.
They do seem soft.
They are. They firm up over time. Usually, if you gently fold the ear, it should spring back into shape, though maybe not instantly in very premature babies who might need more time in the hospital.
Okay, that makes sense.
Well,
Now, noses. Newborn breathing can sound so noisy.
it really can. And that's usually because newborns are obligate nose breathers, mostly.
Meaning they have to breathe through their nose.
Primarily, yes. Their instinct is nose breathing. So if that little nose gets stuffed up with mucus or even just a bit of amniotic fluid still, it sounds loud, snuffly.
Right. And the nose itself can look a bit flat sometimes.
Also very common right after birth, like the head molding, the nose might get a bit squashed during delivery. It almost always rounds out and looks normal within a few days.
And hospitals often give you that little blue bulb syringe.
Yep, the bulb syringe, to gently help clear out any mucus if the baby seems really stuffy and having trouble breathing easily through their nose while feeding, for instance.
Useful little tool. Okay, last one in this area, the mouth.
Crucial for feeding, obviously, so you want to see that the upper and lower jaw seem to fit together okay. When the baby cries or opens their mouth, it should look symmetrical.
No pulling to one side or anything.
Exactly. And importantly, the baby should swallow easily during feeding without gagging or struggling excessively.
Makes sense.
The provider will also check inside, make sure there are no unusual lumps or swellings. And very importantly, check the palate, the roof of the mouth, to ensure it's complete, no cleft or injury.
Right. Checking the palate is standard.
It is. So all these things we've talked about, the soft spots, the head shape, the eyes, ears, nose, mouth, they're all things providers like Omega Pediatrics check carefully.
And speaking of Omega Pediatrics, it's worth mentioning they seem to really understand that parent worries don't stick to a 9-to-5 schedule.
That's a really practical point. Knowing you can get help later in the day is huge. They have extended weekday hours open till 9 p.m. for walk-ins.
Wow, until 9 p.m. That's great.
Yeah, at their Roswell and Alpharetta locations in Georgia. And they also offer telemedicine visits for their established patients. So if something pops up in the evening, you have options.
That flexibility is key. And they cover quite a wide area too, right? North Fulton, Sandy Springs, Johns Creek.
Duluth, Cumming. Yeah, a decent range. Plus, another convenient thing they offer is after-hours immunizations. Getting shots done outside of typical work hours can be a lifesaver for some schedules.
Definitely. If anyone listening wants to check them out, their website is omegapediatrics.com.
Omegapediatrics.com. Easy enough.
So just to kind of wrap up the main points here, many of these things that might look a bit unusual on your newborn initially.
Like the head shape, the soft spots, the wandering eyes, the noisy breathing.
Right. They are often totally normal and tend to resolve themselves pretty quickly, usually within days or weeks.
But, and this is the crucial, but always trust your gut.
Absolutely. If you are worried about anything or something just doesn't feel right to you, don't sit on it.
No, definitely reach out to your pediatrician. That's what they're there for. They are your partner in this. Get that professional advice and reassurance, or get the help that's needed.
Couldn't agree more. Your pediatrician is your go-to resource.
Sure.
So if you found this chat helpful, maybe visit omegapediatrics.com to see more about their services. And hey, if you know other parents-to-be or new parents who might be stressing about some of these things,
share this with them. Let them know they're not alone in wondering about that cone head or those funny eye movements.
Exactly. Spread the word. And please subscribe to Have More Babies, or download the show so you catch our future conversations. We've got lots more parent-focused topics coming up.
And maybe think about this for yourself. What was the one newborn quirk that really surprised you when you first saw it? Or the thing you worried about most? It's always interesting to hear those stories.
That's a great thought. Okay, well, thank you so much for joining us on Have More Babies. We'll catch you next time.
Bye.
Bye, everyone.